Let's get oral. Let's get oral.
Hello, listeners. It's Camille, your host at Let's Get Oral. I am with Dr. Katie Lee. I've been low-level harassing her for a little while to get her on this pod. I'm so excited about what she's doing. She recently wrote a book called Saved by the Mouth. We'll get to tell some of that amazing story for us today, but she's also a clinician and working in the oral systemic space to really broaden this community. So I'm excited to have her here today. Welcome to the studio. How are you?
I'm doing great. Thank you so much.
I'm glad you could make it. So, Dr. Katie Lee, should I call you Katie or do you like Dr. Lee? I like Dr. Lee.
Katie is fine. Yeah, whatever
Excellent.
You prefer, I'm okay with. As long as it's not a 4-letter word, we're good.
Oh, no, we won't be going there today.
Good.
So the book Saved by the Mouth, I know I got it right when it hit the shelves. So it's been a little minute since I've read it, but the opener is an incredible story, and it kind of highlights your venture into this space. So can you tell us what happened and how you got into this oral systemic space?
Sure. So when I was 14 years old, I was involved in a near-death experience. I was on an ATV, or a four-wheeler, as most people might know it. And it was the first time that I had not worn a helmet. And, we were just going to go around the block before my friend's parents were going to come pick her up from the day. And somehow I ended up going head first into a telephone pole going about 35 miles an hour. Broke every bone in my face from my eyebrows down and lost a bunch of teeth. Of course, had a traumatic brain injury, all the things. And I woke up in the hospital about 5 days later. I was in a coma for several days. And when I woke up, my jaws were wired shut and I had a cast on my right wrist. And, everyone was just really surprised that I was A, alive, B, not paralyzed, because, when you do a facial impact like that, of course, you're getting whiplash. And C, I still had, what some would say a working brain and didn't have any brain damage. So it was really a miracle. And during that time of having my jaws wired shut, I broke a bunch of teeth that day when I hit the telephone pole, and I lost a couple teeth. Actually, I lost a bunch of teeth, but they were able to put all of them back in, but 2.
That's incredible.
But they didn't do any root canals or things like that after they put them in, which is what you really need to do. But they were more worried about stabilizing my face at that point. And so my jaws were wired shut, and, I couldn't properly care for my teeth, and I couldn't see a dentist during that time. And while my jaws were wired shut, I was surviving off of mashed potatoes, Ensure, Jello, pudding, ice cream with chocolate. So, all the things you should never eat. But I think during
all the
that
healthy
time,
things, yeah.
I think at that time, my parents were just like, and I had a younger brother and sister. So we were all in survival mode, and it was, kind of like whatever makes her happy at this time, like let her have. Well, if you couple all of the poor nutrition with all of the broken teeth and dental disease that I had, it was kind of a disaster. And so I became emaciated. My liver enzyme spiked and my kidneys started shutting down. And so I felt and learned at a very young age just how important your oral health is to your overall systemic health. And then when I got my wires removed, I remember I took friends with me to the appointment because we were going to go to Olive Garden. All I wanted was Olive Garden breadsticks and salad afterwards.
Oh my gosh,
yes. Yeah. Midwest. Right. And I remember they cut my wires off and the doctor said, okay, open your mouth. And I was stuck and I couldn't open. He's like, open your mouth. And I said, I can't open. So he handed me some popsicle sticks, like tongue depressors, and said, use these to kind of crank your jaw open. It'll loosen up over time. It didn't. My jaw joint was fused shut. So it took 4 years and 9 reconstructive surgeries for me to be able to open my mouth. And during that time, I'm a high school girl and I was missing some front teeth and I had some flippers, which are retainers with teeth on them. And most of the time I'd forget to bring them to school. I certainly couldn't eat lunch with all my friends at the lunch table because you have to take them out. And so it just really had a big, not only physical impact on me, but mental and emotional and social impact on me as well. And so I remember my senior year, I actually ended up getting a rib transplant. So they took my rib, removed my right TMJ and put my rib bone in. And that's how I was able to finally open my mouth. And so once we got my mouth open, then I could get all my teeth fixed and my smile fixed. And I remember looking in the mirror once I got my implant crown delivered on my front tooth. And I was like, this is what I want to do for people. So that not only got me into dentistry, but also took me down this path of oral systemic health because I lived it.
Yes, you did. I was on the other side of your story. My mother and I were in a horrific bicycle accident, and she lost most of her lips, nose, and teeth on the cement. And we were on a shared bicycle. And so I spent a lot of my youth watching her go through surgery after surgery after surgery, having reconstruction, the inside of her mouth placed on the outside to recreate lips. And yeah. So, and then the pain of putting dentures on top of raw tissue that is very sensitive, and learning how to eat and how to smile and behave in public and get a job again because nobody wants to look at you. And yeah, it's a wild ride. I can't imagine
Oh
being
my
in high
gosh.
school for that.
I almost feel like it might be more tragic to be in your situation and see someone going through it, because when you're in it, you're just trying to survive at that point, right? But back then, this was in the 90s, and I'm not sure when that happened with your mom, but people were
78.
not as, okay, people definitely probably back then were not as conscientious about how you make other people feel. And so
Right.
people had many names for me, as you read in the book, but one of them was Elephant Man because I just always had this like
Yeah.
big kind of protrusion from the side from all the jaw surgeries I was having. And then every time they would do a surgery, they cut me down the side of my face and then peel my face over to operate. And so the facial nerve is right there. So this whole side of my face, it looked like I had Bell's palsy for 4 years. I couldn't blink. I couldn't smile. My smile's still crooked to this day, but I had to like tape my eyelids shut at night. I'm still numb over here. So when I eat, I have food all over my face, which is just, I've learned to embrace it at this point. But the reason I bring this up is because, you mentioned how your mom was going through all this transformation. And back then, people really weren't aware of how their actions and staring and pointing and talking made other people feel, right? Nowadays, I feel like we're very sensitive to how we're making other people feel. Back then, nobody, it wasn't top of mind for anyone. And so it was brutal. It was really brutal.
Yeah.
And so I'm sorry you had to watch your mother go through that. That was very traumatic.
Well, I'm sure your mom watching you go through that was a bit over the top.
Yeah. Yeah. I can't imagine. I have a son now, and oh gosh, if anything happened to him, I don't know how you get through that.
Exactly. You just survive. And so I can see how that would make a big impression in every single way. I did kind of want to go through some of how you ended up as a clinician, specifically in the oral systemic space at a time when it wasn't really acknowledged.
So I remember graduating right before I got out of school in 2010. I remember a study was published saying that there was some sort of remote correlation or association between gum health and heart disease. And that was really it. And I remember being like, that's really interesting. Well, fast forward, I had all this student debt. I just needed to get a job, needed to start paying back all my loans. But I always had this kind of seed in the back of my mind that was planted, but hadn't really sprouted yet in terms of, I know this oral systemic connection exists because I've lived it. And so when I first got out of school, I just was trying to survive as well as a new dentist, trying to learn all the procedures and, make enough to make ends meet. But what I started to notice was when patients would come in, my patients who had the most oral disease were also the ones who were the sickest that had systemic disease. So I just started kind of paying attention to all of that. And I started reading a lot
I'm
of,
going to stop you there because I really
yeah,
want to like kind of pick this apart because I don't
yeah.
know that, and all of the healthcare providers in the oral space are really checking in on that systemic piece. And so what types of illnesses or sicknesses were you seeing with these, probably I'm assuming periodontal disease patients?
Yep. So there was a really big correlation between people that had gum disease and many failed root canals. So I want to make sure that, like, a lot of times in oral systemic health, we talk a lot about just gum disease. But I was seeing people, that would come in and they'd have root canals on every single tooth and they'd all have abscesses. Those patients also had a high level of heart disease, but not only heart disease, heart attacks. Saw a lot of that. Saw a lot of gum disease being and patients with diabetics and uncontrolled diabetes.
Yeah.
I saw a lot of gum disease and endo abscesses in women that also had rheumatoid arthritis or kind of some systemic autoimmune disease. I saw a lot of correlation there. And back then, gut health wasn't really a thing,
Yeah.
so we weren't really talking about that. It wasn't really top of mind. But I would say big things were kind of rheumatoid arthritis, fibromyalgia type conditions, heart
Right.
disease, and diabetes were the big ones that I first started to notice.
And fibromyalgia, at least at that time, I don't think was even acknowledged as a real thing. Yeah.
Yeah. Yeah.
Wow.
I think back then it was like chronic pain, right? Chronic pain or restless leg syndrome or something like that
Right,
is what they're kind of
exactly.
labeling it. Yeah.
Yeah, it was frustrating because they just wanted to hang the hat on stress, and it just wasn't
Yeah.
quite right.
Yeah.
So for these patients, how did you start treating them differently?
I would say from the beginning, I have always been very proactive on my approach to dental care. And so when someone would come in and they would have bleeding gums or even minimal pocketing, because back then, the guidelines were you couldn't diagnose periodontal disease until you had 5 millimeters of pocket. Now it's been moved to 4, which thank God. But even when I would see, fours and lots of bleeding, I was recommending treatment. And oftentimes I would hear from patients, you know, honey, you're 26. I've been seeing my dentist for 30 years. Nothing has been wrong. Like, I'm not going to pay you $1,000 to do a cleaning because my last dentist has said everything was fine. So I would say I was much more proactive in terms of my perio treatment than most dentists were at the time because I was telling them, hey, if your gums are bleeding, I would be concerned, right? If your skin started bleeding out of nowhere, you'd be like, what is going on with my skin? Your skin is there because it's meant to protect the inside of your body from the outside environment. And when you have wounds in your skin, that you can get an infection. If you touch something, right, you can get a skin infection, you can get abscesses. That's going on in your mouth. If your gums are bleeding, you have a wound. If they're bleeding and you have a wound, you can get infected.
I'm gonna fight that. Yeah, I'm with you 150%. But at the time, and I think still today, there are so many oral health providers that see bleeding gums and don't do anything, or can't kind of appeal to the patient to really convince them that that's a serious thing. So how do those conversations, what do those look like? How do you get a patient to buy in?
Yeah. So sometimes, and back then I would say I wasn't really relating it to their health history. I'd say I also know you have these other systemic conditions going on. There could potentially be a tie in here, but I wasn't really making that strong argument just yet. In my brain, I was, but outwardly, I wasn't. And so I spent a lot of time trying to educate these people about, hey, look, I don't want to wait until you have massive bone loss around your teeth because then we're looking at surgery and we're looking at just trying to prolong the life of your teeth and gums as long as possible. Let's get in and be preventative so that you don't have to go through this lifelong of disease. So I was more focused on periodontal disease at that point than I was on the ramifications to systemic health. And some patients would agree and they would say, great, let's do it. But then I had other patients that were like, I think you're cuckoo. I think you're a crook and you're trying to take my money. And I would very humbly back off and say, I understand you're not ready for this yet. Let's go ahead and do your regular cleaning. And I'm going to have you back in 3 or 4 months and let's check on it again. And I still take that approach to this day because just because someone has a condition or a disease doesn't necessarily mean that they're ready to treat it, right? And so it's our
Agree.
job as healthcare providers. And I would tell my team, like, we got to meet people where they are. I'd much rather have someone in my ecosystem of the office getting educated every time they come in than us to
Yeah.
say, shame on you for not accepting my treatment, go find another dentist. I've never practiced that way. That's also against the grain. A lot of people don't believe in that. But I would say most people, in fact, like our case acceptance for perio treatment, even back then before saliva testing, was something crazy like 85%, because it took a couple times to educate the patients. And within, 2 or 3 visits, we were having people convert to perio treatment, which was fantastic. So I always encourage people to do that. Don't shame people away. They might not just be ready to treat it yet.
I mean, I feel like you could make a correlation into, learning or any growth opportunity for your spiritual and educational wellness. There are just some times where you're not ready to achieve in one direction, and you just have to be patient and wait and
Yeah.
know that you'll get there eventually. And I think this is a really great way to communicate the fact that, we just have to wait for people to catch up sometimes. And
Yeah.
though it's frustrating on our end, I think that that's the way you build trust in this
Yeah.
environment.
For example, and I talk about this in the book, I had this patient come in, talking about heart disease, actually. I had this patient come in. He was super healthy, fit, muscular, just radiated health, nothing on his medical history. He was probably like upper 40s, lower 50s at the time. And when we took his x-rays, he was one of those patients that had root canals on almost every tooth, and they were all failed, all had abscesses.
Oh my
And
God.
his gums were not great, but not the worst that I'd seen. I would say I was definitely more concerned about the root canals, and he had no symptoms though. And so I'm talking to him about this correlation between, endo abscesses, gum inflammation, and the heart. This was fast forward several years after I started getting into oral systemic health. And he said, well, nothing hurts. My doctor says my blood work is fine. I have 3 kids at home. 2 are going to college. My other one's married and just moved back in with her husband before they're saving up to get the house. So I just don't have space in my life right now to treat this. I think a big part of it was he didn't have the time, space, or money to treat it, but he also just didn't really believe me either. So I did his cleaning. He went on, and a couple years later, he was back in my chair, and I was like, oh, what brought you back in? And he said, well, I was at the gym one day working out, and I felt like I had an elephant sitting on my chest, and it turns out I had a heart attack. And when my doctor did my blood work, he said, there's a couple things that are elevated, but nothing that I would have considered would be high risk for a heart attack. Maybe you should go see your dentist. And he said, your conversation popped into my head, so I'm here to get everything fixed. So
Wow.
people aren't always ready, and
Yeah.
when they are ready, I want to be their provider of choice.
Yeah. So what are some of the protocols that you deploy now in practice that kind of take on that whole oral systemic space? And what do your treatments look like?
Yeah, I would say to keep it, I'm a really big believer in simplistic care. I'm also a big believer in, I don't tout myself as a biological dentist or a functional dentist. I just say I'm a dentist, right? So when people come in, there's basically, 3 or 4 things that I always look at. I always take a CBCT on every patient. That's a 3-dimensional image of their teeth, their jaws, and their airway. The reason I do that is because we know 2-dimensional x-rays are grossly inaccurate, not inaccurate, but they very much show less than what's there. I mean, you have to have about 2/3 of mineral loss before you can actually see it on a 2-dimensional x-ray. And teeth are
I
3-dimensional
don't think I
objects.
realized it was 2/3. That's quite a bit.
It's a
Okay.
lot. It's a lot.
Yeah.
You're missing about half if you're only looking at like 2-dimensional PAs. You're missing about half because our teeth are 3-dimensional objects. So especially when you get into the posterior where you have multiple roots, if your roots are overlapped in any way and the bone is overlapped, you're not going to see anything. So I take a CBCT on everybody just so that I can see if there's any pathology in the sinuses that could attribute to potential airway issues. I want to see their airway volume, and I want to see if there's any abscesses on teeth that you wouldn't normally see. So CBCT everyone gets. Everyone also gets a saliva test, a microbiome test. I am wanting to see, yes.
Jonathan's clapping for those of you who can't see us.
I want to see what is making up this patient's oral microbiome. Because again, unless you do a test, you don't know what's there. You know, when you go to your doctor with a sore throat, they don't just assume it's strep and give you amoxicillin, right? They're going to do a whole gamut of tests. And I actually just went through this. They're going to do a whole gamut of tests before deciding what to diagnose you with. And in dentistry, we assume that if someone has bleeding gums, that they have an infection from one type of bacteria and that our cleaning is going to treat that. And it doesn't. You know, the incidence of periodontal disease worldwide is increasing by 34%. So clearly, as dentists, we are not doing our job, and the treatments that we are rendering are not all that successful. And it's because half of all the bad pathogens in our mouth are resistant to cleaning alone. So if you're only doing mechanical cleaning, you're not treating any of those pathogens. So if you don't have that test, you don't know what treatment to render.
So I have to ask, what salivary test is your favorite?
I would say they're all. I'll tell you what I like about a lot of them. Let me start with that. So I traditionally have used oral DNA for 10 years. That's the test I start with, and that's kind of my go-to test right now. The reason I like them is because they make it easy for me as a practitioner. They can drop ship to my patients, and they can share results with both of us, which make it really easy. I also like that they relate their bacteria to systemic health, which many saliva test companies are doing now. And they also recommend what treatments are needed to treat those bacteria, which a lot of companies are doing now, but they were really the first to do that.
I've heard some criticism on the recommendations, just because, that's a bold move for a salivary testing company to then deploy a recommendation when, it should be your healthcare provider. So you feel like it's a positive. I think
It
it's a
is.
positive,
It
but
is a
can you tell
positive.
me why? Why?
Yeah. So those people who say that they are criticizing it, I feel like those are very insecure and inexperienced providers. I'm going to say that right now because here's the thing. They are recommendations to the provider. The provider at the end of the day is the one that has the license that can then decide if what treatment is needed. They in no way, shape, or form are saying what needs to be done. And these recommendations are based off of dozens of papers of research. They're based off of the scientists who are doing all of this work in the bench, at the bench. They're based off of clinician recommendations on their clinical board. So they're not pulling these out of Chat GPT or WebMD, right? Like these are well-researched recommendations. And at the end of the day, if you don't like them, you're the clinician, don't do them. So when people say they don't like that, I'm like, then just ignore it. You don't have to follow it. So sorry, I'll get off my soapbox there.
Yeah.
Some other good ones that I really like, Oral Genome is just coming to the market right now. Oral Genome is great because it looks at things other than the microbiome. So it looks at PG, but then it also looks at the buffering capacity of the saliva. It looks at
I
salivary
do love that.
pH. It looks at glucose. It's looking at nitric oxide. It's looking at MMPH. So I view Oral Genome as kind of a more advanced test. So if someone is just getting into salivary testing, I might recommend them to use something else because you got to know how to treat the microbiome first before you start trying to modulate and affect all these other things. Dentagnostics test MMP8, I think, is a must for a dental practice. That is measuring the collagenase enzyme MMP8. That allows us to be 18 months predictive of future attachment loss, which is really great. And it's a point of care test. So MMP8 is telling us the inflammatory response of the body, whereas a lot of the other salivary tests are telling us microbiome of the patient. So you need both because we know perio disease is both systemic inflammation and microbiome. So I like both of those. Bristle is great. It's a direct to consumer test. What I like about Bristle is they also tell you the beneficial microbes and can tell you if you need to boost your beneficial microbiome. They also have a bad breath test that a lot of patients like. And I feel like bad breath is a strong motivator for someone to want to get their microbiome tested more so than bleeding gums, right? People are more concerned about their breath than their gums. So I think it's a really good entry point into microbiome testing. So Bristle's another really good one. Simply Perio is great. So I think they're all great and they all have their pluses and minuses.
I do think that we have a problem with the clinical names and talking to the patients. I think that, once you make the leap to oral systemic, you can easily make the bridge or the argument for having oral health as part of your kind of anti-aging pillar or wellness, routine. So I think those are pieces that can easily be bridged with some of those tests, just because you can have those deeper conversations.
100%. It absolutely should be part of someone's wellness and longevity plan. And what's really great is, we have people like Andrew Huberman and Mark Hyman that are starting to talk about this stuff. For so long, they've been talking about biohacking and health and all these things that you can do for your health, but they left out the
Yeah.
oral component. When
Right.
the mouth is the entryway to the body, if that's not healthy, nothing else is going to be healthy, especially the gut. And 70% of our immune system is in our gut. So you can't forget the mouth. The mouth is the start to the gut. It's the same system, different stop. So I'm glad
Yeah.
that they're talking
I,
about
I
this.
yeah, the gut studies kill me, because we get so hung up on these gut microbiome, but do you know how they alter the gut microbiome in those clinical and animal studies? They feed
No,
them different things. They put things in their mouth.
in their mouth. Shocking. But let's not talk about the oral microbiome.
No, no, it's not involved. Um,
Yeah.
and then we have our famous and historical Baker model of animal infection, where you basically drown the mouse in PG, Porphyromonas gingivalis, in a bolus every day for like a month. And then it causes periodontal disease. Do you know why? It's because it now has disrupted the gut. And so you have
Yeah.
this full circular loop. You now have
Yeah.
systemic infection,
Yeah.
or inflammation from the released gut bacteria, which brings me back to your protocol. So you're doing salivary testing, you're
Mhm.
doing the full scan.
Another big one that I really like is to check airway. Airway is critically important. And, I think the crazy statistic, like 80 to 85% of people who have an airway issue are undiagnosed, which is
Yeah.
very, very scary. And there's a very strong correlation, again, about 80% of people that have diabetes that also have an airway issue. And so, as dentists, we're looking at the airway when we're looking in patients' mouths. So it just makes sense for us to examine some risk factors that we could see and to check the airway, because undiagnosed and untreated sleep apnea is fatal. It's just a matter of time. And it's something that
Right.
only gets worse unless it's caused by obesity, right? But as we age and we lose our collagen and muscle tone, things start to sag. And in women, it's even worse because we lose our bone density, or our bones start to shrink post menopause. And so the attachments become smaller, and then we start to get collapse of the airway. So postmenopausal women, this is huge. And most of my airway patients in my previous practice were tiny postmenopausal women that started having really severe anxiety, brain fog, racing hearts, and chest pains and acid reflux. And I would say, let's check your airway. And they'd say, but I'm not, an obese wrestler. Like, I don't think I have an airway issue. I'm not even snoring. And we would test them. And most often they either had moderate or severe sleep apnea.
Wow. So
So if
what's
you want to save your
do you,
brain, get your airway checked.
yeah, no kidding. Do you refer out for that, or do you have people in house to help with those breathing ailments?
So what we do is I have patients will take a at-home sleep study, and then all of that data gets uploaded to the cloud, and then we have board certified sleep physicians that will read and interpret and provide the diagnosis. And then based off of how severe they are, if they're mild to moderate, that is something that you are able to treat in the dental office with an oral appliance.
Mm-hmm.
If they're severe, then they have to try CPAP first. If they fail CPAP or are non-compliant, then you can do an oral appliance, or you can do it in conjunction with a CPAP for severe patients.
Okay. Wow. Okay. That's stepwise
Yeah.
a
And
huge
airway.
factor. So is the airway test, at home test, is that like through an additional vendor?
So it depends. There's kind of some different sleep studies that you can keep in your office. At the time, I was using Zephyr, which is a Canadian company. Unfortunately, they went out of business, but there's over-the-counter companies that are out there. Watchpad is one of them that you can do. I don't know why I'm blanking on the other name. It's going to come to me as soon as we start talking about it. But yeah, there's several that you can order online that can be sent to your house. But airway is critically important when you think about longevity, because you need oxygen to your brain to keep your brain cells
Yes.
alive. So if you're not breathing while you're sleeping, hopefully we're sleeping 6 to 8 hours a day, that's a long time for your brain not to have oxygen. And further,
Yeah.
when we have apnea, we're not getting enough nitric oxide in our body because we're breathing through our mouth instead of our nose. And nitric oxide is a very potent vasodilator that we need. And
Right.
so if we're not getting the nitric oxide, we're seeing a lot of vasoconstriction, and that's reducing blood flow to the heart. It's reducing blood flow to the brain, which isn't good. And then obviously breathing through your mouth dries out your mouth, makes it more acidic, and changes your microbiome, which then causes systemic
Exactly.
inflammation. So it's a big systemic issue.
Right. Yes, we're all on board there. So, with all of these results, coming back to the patient who may be resistant, how do you take these tools and have those deeper conversations?
So I've had some patients decline or kind of refuse to get a saliva test. For me, the next question is always why? Tell me why. If they say it's financial, I try and find a way to make it affordable for them, which a saliva test is very, very affordable, much more affordable than a lot of medical tests. So I try and make it as affordable for them as possible. If after talking to them about the money, I can tell it's not about the money, then it's usually about, oh, I don't believe you that this has a systemic component, or I don't want to know how sick I am. Like my dad is one of those people, right? Like he would rather just drop dead one day than like have a bad diagnosis that he has to live with. And
Yeah.
and so depending on, there's a lot of psychology that goes into dealing with patients, as you know. So if someone is the hardest one to treat is going to be the one that just doesn't believe or care that their mouth is affecting their systemic body. At that point in time, I just move on, right? They're not ready yet to hear what I have to say.
Yeah.
If someone's fearful, well, now I need to change my language to, this is really good information that we have, because when we have this, we can prevent and reverse a lot of the damage that's happening to your body. So I change. I like to make my case presentations and my diagnosis and my treatment plans and stuff very positive for patients about how we're going to improve their life. And, by treating your airway, you're going to sleep much better. The acid reflux is going to stop. You're going to stop having the bad breath, and you're going to stop breaking teeth. So I try and point it down the path of how my care is going to benefit their life versus this care is expensive, painful, and time consuming, because no one wants to sign up for that.
Of course. No, of course. Okay. So I really appreciate that, because I think it is hard to have these conversations, and at the end of the day, it really is about the consultation and, how do you get that buy-in, and how do you create the importance for your patient? And I think all of these tools help to give those visuals and pieces of information that you can dive deeper into. It makes sense why some of the patients resisting, they just don't want the information because they know it's going to lead to a bigger discussion that might be more financially impactful.
Well, and what I've learned too about anxious patients is that the best way to get an anxious patient to agree to treatment is by talking about benefits and also making it sound as simple and easy as possible. The more words you use and the longer your explanation, the more complicated and painful a procedure sounds, and expensive. So the bigger the issue, the bigger the treatment plan, the shorter amount of time I really spend talking about it, because I don't want patients to feel really overwhelmed.
Right. So when do you go in for retesting?
Great question. So depending on how bad their saliva test is, which most of them are pretty bad, I usually will recommend retesting between 10 and 12 weeks post-treatment, because I want to make sure that we've done the right test, but I also want to make sure that another pathogen hasn't spiked. So sometimes what will happen is if someone has had a very long-standing infection, say they haven't been in 5+ years, or let's say someone has a systemic disease like diabetes, heart disease, gut issues, maybe they're a smoker, they don't really heal as well. And their immune system isn't robust enough to really tackle this infection, which is why we have to treat it. And so oftentimes when I treat and I retest, we'll see other bugs that we weren't really focused on spike. And so now we need to go in and treat those appropriately. And so I always warn patients, like, you haven't been in 5, 6, 7 years. You have all these systemic conditions. you cannot expect complete eradication of this infection with one treatment. It's not going to happen.
Right.
It may take us a couple passes before we can get this. And by the way, this is independent of your insurance. We will maximize your insurance as best we can. We will use it to our fullest ability. But, you know, if you haven't been in 7 years, we're going to have to take a couple passes at this. So I kind of set them up for that in the beginning.
Well, to your point, the oral systemic piece is very important. So when you're treating the mouth, but they have rheumatoid arthritis or they have diabetes that's not well controlled, those feed forward the opportunity in the mouth. So just because you have gained a hold for the moment, it doesn't mean that it's going to last, because those other pathologies remain. And if you have a higher baseline of inflammation systemically, that's feeding your tissues. So of course, those tissues are going to have like these activated components in it, and those are food for those bad bugs. So this is kind of why I wanted to get to that retest. And how do you treat those patients differently? Because obviously they're going to be a more long-term project, or, you know, their maintenance is going to look a lot different. And how do you check in on that systemic piece to see if you can get improvement there too?
Yeah. So much to say about this, and I hope I remember all of what's in my mind right now to say. And a big piece of this is why taking, and this was kind of the fourth step to my intake with my patients, is to take a really robust and detailed medical, dental, and family history. I also want to know family history, because we know a lot of conditions tend to run in families, not necessarily genetically, but kind of environmentally and how we're raised. Because we know most systemic disease processes take about 10 years of something being amiss before they are at the threshold for a diagnosis. So just because this 25-year-old doesn't have heart disease now, I need to treat him like he does if his dad has had 2 heart attacks, right? So making sure I have a really good detailed medical, dental, family history is important. The other thing is making sure that I have MMP8 testing in my practice, because that's going to tell me their systemic immune response. So I might be able to get the patient's microbiome exactly where I want it, or pretty close. But if their MMP8 is remaining high, then I know that they're still breaking down collagen and gum tissue, and whatever bacteria are in the mouth, even the little bit of bad stuff, is still getting in to their bloodstream and causing systemic issues. So I need to see both. What I tell patients is our health can change in as little as 90 days. And our microbiome is a fluid ecosystem, and it's constantly under attack. It's not a closed system. Our mouth is open all the time, right? So we are constantly under attack by our environment, by sicknesses around us, by people in our homes, if we're traveling, what we're putting in our mouth, the foods that we're eating. So this isn't a one and done situation. It's not like you go to the gym one time and you have a 6-pack. That's not how this works. We are going to have to continually monitor. It would be amazing. I'll work out for like 3 weeks and I'm like, why can't I get the results that I want? But I'm like, so I need to continually check your microbiome, and how often I retest depends on their systemic conditions, but it also depends on their lifestyle. So do I have someone that's high stress? Do I have someone that has an airway issue? Because it's really going to change their microbiome. Are they smoking? Are they drinking a lot of alcohol? That's a big one. And so depending on their medical, dental, family history, depending on how they present, and then depending on their lifestyle, determines how much I retest. I try and retest people at least once a year, kind of as a reset to see where we're at. But I would only put them on that 1-year maintenance if I've gotten them to a place of balance ahead of time. If not, I would recommend a retest every time they're coming in. Because it takes a while to get the microbiome. And the whole goal is, and that's why I like the bristle test is, and I just had a patient from Canada that I'm working with that we had to it took a couple rounds to get her and her husband, the microbiome, the bad pathogens gone. But then we switched over to the bristle test because I wanted to see, how much commensal bacteria do you have? And they were low, which makes sense because we did some antibiotics and there's some things, other things that we had to do. So I said, okay, now we're rebuilding. So now let's talk about how we rebuild the microbiome. Let's talk about how we rebuild those bacteria that help us with nitric oxide. And so, there's a wipeout stage and a rebuild stage, and that takes time.
What are you rebuilding with?
So a lot of probiotics, food is really important. So microbiome loves plant-based diets, specifically for fiber. So any vegetables, high fiber. I always tell them to do things like kombucha, sauerkraut, fermented foods are going to be really, really great. And then I'm a big fan of lozenges and oral probiotics just to kind of help put in the good guys that we want to see.
Are there any specific dietary supplements, lozenges and chews that you would recommend?
Yeah. So they're on my, of course I keep all my stuff on my desk, right? Because I'm trying all of them.
Same. They're
So,
women on
so there's this company called Bliss. They are out of New Zealand. And so what's really cool about Bliss is they manufacture the M18, which is the strain that's really good for gum health. And they also manufacture K12, which is really good for respiratory and ENT health. I like that, like for my son, for example, because he's in daycare and always getting sick. But most of the probiotics on the market will have the M18 or the K12 strain in them. So just look at the ingredients and make sure it at least has an M18 in there. The other one that I like is a product called Daily Dental Care by Primal Health. Have you heard of it? Dr. Emily Stein.
Yeah, she was just on, actually.
Was
yeah.
she? She's actually coming to my my new training and education center and doing a whole course on salivary diagnostics. Yeah, brilliant. So she created a product called couple of products called Phosphodent and Protectin, which I absolutely love because one is really great for cavities, preventing cavities, and the other is really great for gum disease. And the story is really
cool. So both
cool
of those, we just learned about this, a couple weeks ago, but they're basically tailoring the food of the microbiome to feed the correct ones or to starve out the wrong ones. Right. Okay.
Yes. So what I typically will explain it as, because a lot of people know the ketogenic diet, right? Mm-hmm. And so her compound basically turns the mouth into a ketogenic environment, which starves off the bad pathogens. The bad pathogens in our mouth love sugar. So the more sugar you eat, you can guarantee the worse your microbiome will be. And so her compounds kind of starve off the bad pathogens and feed the good bacteria. So I usually recommend both. Do a good oral probiotic that will put good bugs back in, but also throughout the day, pop in a couple of her mints, which taste fantastic, just to kind of starve off the bad ones. So I like to do them together.
So, just for your awareness, some of the periopathogens that are less about cavities and more about periodontal disease are feeding off the inflammatory environment. So I'm very obsessed with her work because I feel like it's a perfect complement to my work because I'm trying to starve out the inflammation side and she's trying to starve. Yeah. Anyway, so definitely some synergistic mind meld there.
I love it. We need to have you come to the center and teach too.
Yeah, I would love to. I love that kind of stuff. I have all sorts of plans. I'll let you in on them.
Yeah.
So you have a nice smattering of really interesting products to offer. Do you think the uptake for those products is pretty promising?
We'll see. So the new center that's opening, I'm trying to combine all the different modalities of healthcare that have impacted my life or my patients' lives into one location. Because what I was finding was, I'd refer patients out to go see certain providers for certain things. And they would come back to me and say, I can't find that provider. I don't have that provider. They're booked out. Or I went to them and they said, you're crazy and the mouth has no effect on this. So my vision now is let's put everyone in one location. Let's all speak the same language of oral systemic health. So that way we can improve the access to care, improve the access to comprehensive care for our patients. And so we'll see. Hopefully people will uptake what we're offering, but only time will tell. I think there's going to be a lot of education that's going to be needed to have for patients to really grasp what we're trying to do.
Yeah, I agree. Well, so we didn't really introduce your center. You said you took a couple years off to kind of reorganize and to create this center, specifically oral health center.
Yeah.
Tell us a little bit about kind of your idea and how you're building it out.
Yeah. So it's an oral health and wellness center. It's called the Collective Health Society. The idea is it's a health collective. So we have functional medicine doctor. We have several certified nutritionists. certified nutrition specialists. CNS is their title. One focuses on gut microbiome, one focuses on fertility, and one focuses on like herbal medicine. I have a myofunctional therapist, which is really important for our sleep apnea division. And so those are the providers we have right now. So the whole idea is bringing everyone into one space. So when people come in, and how I believe it's going to work, at least in the beginning, is people are going to come in through the dental clinic, but the dental medical clinic is all one practice. There is no division. So we have dental rooms and medical rooms all in the same space. We have an IV infusion bay also. So after people get their mercury fillings removed, we can go detox them. We have wound healing, anti-inflammatory IVs that we can do. The whole idea is come in through dentistry, let's do our initial testing, and then based off of what we see in your medical history, we'll get you to the right provider to try and boost our results as much as possible. Because as a dentist, I can fix this, but the mouth, as we're talking about, is not a silo. So I don't want to practice in a silo type of environment. I'm trying to be more comprehensive and inclusive.
I really appreciate that. And this has been done in not so much in dentistry, but for example, in HIV, there have been practices to kind of pull comprehensively a nice care team because, people with HIV, at least historically, less so now because the treatments are so good. But it's one of the biggest hurdles for most people kind of putting together a program like yours is that it ends up bleeding into a personalized medicine approach and private care because it ends up being so expensive. So do you, as far as a business model, I'm kind of curious how you're positioning that aspect to either get around or create opportunity for insurance providers, or, how you're approaching that.
That's a really great question. And I will admit that I don't have it figured out. We're going to try things, but what people know about me is I'm a fast mover and a fast adopter. So if something's not working, we will move. My dental clinic, which again is how we're advertising everyone coming in through first, is going to be taking insurance. So we take insurance and we will use insurance for what insurance will cover. However, we make it very clear to the patient that a lot of the things that we are going to be doing won't be covered by insurance. So if we are doing cleanings, exams, x-rays, fillings, crowns, those are all services covered by dentists, by insurance. We will absolutely accept that. However, other things that may be needed, just because your insurance company doesn't cover them doesn't mean that they're not needed. Insurance is a business model, right? They're not based off of what's best for the patient.
Absolutely. Yeah.
Then in terms of going to the functional medicine side, yes, that is out of pocket. However, most of the things in functional medicine are a lot of testing, and a lot of tests can be done through your insurance. So the clinician can order those tests. You can utilize your insurance and go to a lab that your insurance will cover or help with. And then you're just paying for the interpretation, right, from the provider. And then you can buy the supplements and herbs and tinctures and things like that you need. But we are making it very, very affordable for patients to be able to come and get those consultations. I also believe in having coaches and certified nutritionists and things like that can then take what the functional medicine doctor is talking about and continually coach that patient on their journey, because they're going to be more affordable than seeing the functional medicine doctor all the time. So we're trying to do all these things to make it affordable for people while still being able to run a business, because the medical insurance model is based on volume, and volume and quick appointments doesn't get you the best result, which is why Americans, even though we spend more money on healthcare than anyone else in the world, we are also the sickest. So that doesn't work. So we're trying to find a happy middle ground between the two. And then we're partnering with a bunch of different financing vendors out there where patients can get 0% financing for the care that they need. And then they can spread their payment out over 12 to 18 months. And the practice absorbs the interest fee. So patients pay zero, practice pays their interest for them. So there's lots of things we're trying to do. We'll see if it works. If it doesn't, we'll fix it.
Right. Wow. I'm excited to see how this goes. How many dental providers are you going to have under this roof?
So initially we're starting out with just me. So we open, first patient is in less than 30 days. So we are starting, I know, So we are starting out with just me because it's really important that we set the tone and the culture. So I have a bunch of different medical providers. I have myself. I have another dentist actually that I just interviewed this week that I love, that I will be bringing her on. It's just a matter of timing. But, it's a big clinic. It's a 15,400 square foot center. So we
Wow.
have lots of space to add on. I just want to make sure that we're building it the right way. We're getting results and patients are happy. So we're going to crawl before we walk.
Yeah. I mean, that's smart. How about hygienists?
We are trying. Hygienists are like unicorns right now. It is very,
Hmm.
very, very difficult to find hygienists. I'd rather have a team of hygienists working for me than bringing on another dentist at the time, because hygienists have such an important role in controlling gum inflammation, gum disease, and systemic health. And so I'm willing to pay. I'm putting a PSA out there. If you know of any hygienists that want to practice oral systemic health wise, send them my way, because I will hire them in a
I
heartbeat.
will. I will. We have a large RDH community that listens, so
Yeah.
this is a good platform for you.
I'm trying. I have 4 hygiene right now. I have 4 hygiene rooms that I'm looking to fill with providers, and we have all state of the art equipment for them. We have
And where are you
ozone.
located?
I'm in Centennial, is where
Ozone.
Centennial, Colorado. Yeah. We have
Okay.
ozone, we have lasers, we have the EMS system, we have, air poly, we have all the things. So if someone likes toys, they should come to my office for hygiene.
Amazing. Amazing. Definitely. I know you guys are listening.
Yes,
Who doesn't
please
want to be in
come.
Colorado? That place is
I
amazing
know.
too.
Yeah. And we have
Yeah.
upstairs, I think a big piece of this, to getting the word out to not only patients but clinicians, is we have a training and
Yeah.
education center on the second floor. And so that's where we're having
Incredible.
people come in, like Dr. Emily Stein's going to come do a lecture for us on salivary diagnostics. So we have in-person courses that will be there. And we also have on-demand courses that people can take as well if they can't get
Perfect.
there in person. So really
Yeah.
excited to be opening that as well.
Wow, that's incredible. A whole educational center. So will you do, so we have Emily Stein coming in and she'll talk about the microbiome in, I think, the best way. Are you doing kind of clinical drills up there where you're teaching on new techniques and methods and
Yeah,
yeah.
so we have some CBCT courses. So we're partnering with
Hmm.
Dexis on CBCT. So how to read, interpret, and implement CBCT in your office. We have full digital workflows from intraoral scanning to implant planning. I think we're going to be doing big restorative course with a 3D printing company. Can't say the
Wow.
name of the company yet, but I think everyone will
Sure.
know what I'm talking about. We have a couple sleep apnea courses. So we're doing one targeted for hygienists with Cloud Dentistry in partnership with Cloud Dentistry. And then we're doing one targeted for orthodontists and advanced GPs with Dr. Lane Martin, who's a board certified orthodontist and certified sleep dentist. So he's coming in to
Wow.
teach his protocol. And then something I'm really proud of is we're doing laser certification courses for hygienists so they can use laser.
Yeah.
And something I'm really proud of is we're also trying to develop clinicians to be good leaders and to run practices where people want to work. So Holland Hayes, who's a Fortune 500 company speaker, she's been featured all over CNN and all kinds of places. She's coming in to talk about, from drama to diversity, the resilient dentist, how to promote team building and team growth and, lessen burnout. So we have 4 courses with her. And then I'm partnering with someone to do courses on suicide prevention because
Amazing.
suicide in dentistry is
It's huge.
unfortunately we lost two very big prominent providers in our community last year to suicide.
Wow.
And so all the proceeds to that course, and that's an online course, all the proceeds go to a charity that helps professionals with suicide prevention and intervention. So we're trying to be as well-rounded as possible.
Wow, that's amazing. I'm so excited. Yeah, I'm gonna definitely crash your building to see what
Yeah,
I can
I'd love to have you.
learn there because there's so
Yeah,
much happening. That's incredible.
thank you.
Congratulations. Jonathan, do you have any final questions?
Are you attending any shows or meetings this year to be able to connect with people like ourselves and other people in our community?
I am, and I need to attend more. So I was just at Chicago Midwinter. I'm actually speaking at the Connecticut State Dental Association. I think that's coming up in May or June. So I'll be talking there about oral systemic health and also oral systemic health as it relates to implant health and longevity. So I'm really excited about that talk.
Very cool.
I do the Bulletproof. This is the second year I'm going back to the Bulletproof dental conference that is in the fall. Open to suggestions. If you want me to go somewhere, just let me know. I just have to get it on the calendar. I've been pretty busy with this new center. Construction takes up a lot of time.
Who would have guessed?
Yeah, no kidding.
And then second question, we generally ask this for a lot of the guests who come on the podcast. Are there any books, shows, any other types of media that you're currently consuming right now?
Oh my gosh. So I am an avid reader. One of my New Year's resolutions was to read like a CEO. So I read somewhere that CEOs read about 56 books a year, 56 or 60. My goal is to read 52 books. I know it's to read 52 books in a year. I've had to resort to audiobooks, which I've always been against in the past because I'm like, there's something so nice about holding a book and turning the page. And I love to write notes in my book as I'm reading, but it's just not feasible with this new practice and a baby. So I've resorted to audiobooks. What I'm really into right now is about creating cultures within the practice for employees and patients. So I'm doing a lot of Walt Disney stuff by Lee Cockrell. So reading a lot of the Disney stuff. They're a really incredible enterprise, and what they've been able to do in terms of training their team and reducing turnover and creating such a magical experience for their customers is really cool. So I read a lot of that. Just finished with Unreasonable Hospitality, which is a book about a restaurant in New York, Madison Square. What is it? Madison Park. Blanking, but it's a Michelin 3-star Michelin restaurant in New York. That book was phenomenal. Unreasonable Hospitality. I would recommend that to anyone and everyone.
That's a great title.
Yeah. Oh, it's so good. And I use that. I'm creating my employee manuals right now, so I'm using a lot of those concepts. And then really into ozone, studying a lot about ozone. And I'm really into Gary Brecka biohacking stuff now. So you can see I have like my Echo Flask hydrogen water, trying to find a way to upgrade my biology because I feel like I'm going to need a lot more stamina and energy to get everything done that I need to get done. So trying to find a way to like,
how do you do it all?
Happen. Yeah. While still maintaining sanity. Right. So trying to hack my way to the top.
Oh, I feel you there. I actually, I work out all the time, but I could tell I was personally slipping. And so I got a trainer recently, and it's remote. It's all via app, check in once a month. But I have to say, after 6 weeks, after feeling like I was hitting a wall, I broke through, and I feel like way more alive than I have for a while. So
I think health trainers are critical. Especially as you get older. When you're younger, it's like, oh, let's go work out. I love it. And then as you get older, that's the first thing, at least on my list, to fall. And so having a trainer or an accountability coach or going to a class, I think is really, really important. And what I've started doing now is running a lot, which I'm in the past have not been a runner. I'm trying to change that narrative in my head that I am a runner. So what I'm trying to do now is habit stack. So I'm doing these long distance runs, and I'm listening to my audiobooks while I'm running. So, habit stacking. So I'm getting a lot done. That's an hour and a half to 2 hours of running. And then I get through, a book a week.
A week.
Yeah.
Amazing.
Nice.
I'm inspired because I feel like I'll be upping my cardio game. I don't know about a 2-hour run though. Maybe I'll have to do some meditation on my running.
There you go. Up until recently, I have never ran more than 3 miles.
Same.
Like at a time in my entire life. And it's always been on a treadmill, never been outside. Now all of a sudden I'm running long distances outside. It's pretty crazy to think about, but
I'm inspired.
You can do it.
You're inspired. All right. I'm interested. I think the audiobooks will help.
That helps. As soon as I switched to outdoor running and as soon as I switched to an audiobook versus like music, which someone told me to do that. And I was like, that's so dumb. Like I would never want to listen to a book while I'm running. I need something to motivate me. No, it like takes your mind off the fact that you're running.
Right. I feel you all the way on there. And I have tried to listen to audiobooks during weight training, but I'm too like I have to have the mind numbing music on because I need to focus on the body. But
Yeah.
to your point on and the running, as long as you have decent form, you
Yeah.
can
And
kind of
running
check out a little bit.
is machine like, right? I mean, it's like robotic. It's the
Exactly.
same thing over and
Uh-huh.
over. So
Yeah,
to
it's like
listen to
driving.
something, yeah. So to
Yeah.
take your mind off of it, I really recommend the audiobook.
Yeah, okay. I'm sold. Well, thank you so much for coming in today. I'm so glad that you had a moment to spare given all that you're doing. That's incredible. I'm so excited for you to see how this goes. So I'm gonna check in with you in a year and see if we can have you back on and give us a
Yeah.
good update on how it's
Yeah.
going, because this is incredible. I think we can
Yeah.
all learn a million things here. So thank
Yeah.
you.
Next year we'll have to do a live broadcast from the center.
Yeah.
Oh my
That'd be
gosh.
cool.
Yes.
Wouldn't that be cool?
Yeah. Any excuse to get to Colorado. That'd be great.
Well, thanks for having me. I appreciate the time.
Thank you. All right. Until next time.
Let's get